Okay guys, so now we're going to be doing our neck palpation. So we're going to be looking at upper fibres traps, we're going to be looking at scalenes, and we're going to be looking at the SCM. So to start, just a quick review, we know our upper fiber trap starts at the EOP, comes down to nuchal ligament and C7, and it's going to go down to the collarbone, the acromion, and a little bit onto the spine of the scapula. So the action, of course, is to elevate the shoulder. So we're going to get our model to elevate the shoulder, and we can already see that muscle pop up. So to palpate, again, we would have our hands close to that origin insertion, and we're just going to palpate that muscle very easily for us, right? We're going to be able to palpate the belly of that muscle. Bring your shoulder down for me, thank you. Next one we're going to do is our scalenes. Remember, ipsilateral contraction of our scalenes is going to be slight flexion and ipsilateral side flexion. Okay, so for that, we're going to just take our patient slightly into a little bit of flexion and a little bit of ipsilateral side flexion. Okay, so we're treating or we're palpating the right scalenes in this case, so anterior, middle, and posterior scalenes. Remembering they come off of C2 to C7, the lateral part of the spine, the transverse process, and attach to the first and second ribs. So again, we're going to place our hands close to the first and second ribs as we can, and we're just going to place a little bit of force going against the pull of the muscle. So we're going to try to keep our force in the frontal plane, and what we're going to do is then we're going to palpate. So with our stationary hand here, we're going to palpate the scalenes, and we should feel those pop up pretty quickly. They should feel like piano keys, or piano strings, sorry. I don't even know if pianos have strings. Guitar strings, let's go with that. And our third muscle we're going to be looking at here is our sternocleidomastoid. So remembering, if we can say the name, the SCM, we know it's going to come from that SC joint, and it's going to come up here to our mastoid, which we palpated before. Remember, it feels like a dinosaur tooth. And the action, of course, is ipsilateral side flexion and contralateral rotation. And even here, we can see that nice big muscle popping out. Okay, so again, we can palpate that muscle belly, and we can add a little bit of rotation force against our client there, trying to rotate the back ipsilaterally, and we should really easily feel that muscle pop out into our fingers. Okay guys, for our next palpation skill, we're going to be looking at the anterior, middle, and posterior deltoids. And if you remember from class, our mnemonic is the deltoids help you carry sacks. So if you're thinking about carrying groceries, that should help you remember what our attachment points are. All the deltoids attach into the deltoid tuberosity, and sacks stand for spine of the scapula, acromion, and your clavicle. Okay, so posterior deltoid is on the spine of your scap, the acromion is the middle delt, and your clavicle is your anterior delt. We remember, obviously, from our anatomy, right? Our deltoid, and specifically our middle deltoid, primarily is going to help with abduction. So again, we can be close here near the acromion and just below the deltoid tuberosity, and we're going to apply pressure in the adduction direction while our client here holds their arm up. Okay, and again, we could just gently palpate the muscle. Okay, if we wanted to look at the anterior delt, we're going to come a little bit anteriorly, okay, from the midline of the body, and a little bit of internal rotation. Okay, so we're going to get them to push back. Same thing, just below the deltoid tuberosity, just above the clavicle, and we're going to push down into that movement pattern, and we're going to palpate that anterior delt just right here. Posterior delt, we're going to come back. It does abduction and external rotation just behind or posterior to the midline of the body, and again, we're going to be just below the deltoid tuberosity, above the spine of the scapula, and we're going to apply that downward pressure, and we're going to be able to see the posterior delt right back here. Last two muscle groups we're going to attack here with our palpation skills with our client now in prone. We're going to start with the triceps. Our long head of tricep initiates at the supraglenoid fossa, and it's going to go, as my model's laughing at me, and then we've got our lateral head of the tricep originating from obviously the lateral aspect of the humerus, and the medial head on the medial aspect divided by the radial line. That's not so important to us. What we need to remember is they all attach into the olecranon. So again, we're going to stabilize just above the shoulder where that long head of tricep attaches, and we're going to get our client to go into a little bit of extension we're going to be just below the olecranon, and we're going to apply that pressure. Now again, we shouldn't have to worry too much of the shoulder because of gravity, so now we can just palpate with our other hand, and we can see the muscle activation here in the tricep. Again, relax. Now, the second muscle is going to be our Latissimus Dorsi. It's going to come off that iliac crest, the lumbar fascia, the lower thoracic spine, as well as a couple of the ribs, and even a little bit off of the inferior angle of the scapula. And it's going to come up and around. I'm just going to move my camera here. Up and around. It's going to go hook anteriorly into the intertubercular groove. I hope you all said that 10 times with me. Of the arms, it's going to come to the anterior aspect, so we know it's going to be a little bit of internal rotation with that extension. So we're going to take our model, we're going to bring her back into extension with that internal rotation, okay, to really get that muscle fired up. And here we can just apply a little bit of flexion moment to get that to pop up. I'm going to take my hand away just so you guys can see, and then we're going to come and we're going to palpate that muscle. Remember, we said kind of below and off of that inferior angle of the scapula, so we can see that big muscle pop all the way up, and we can find it coming all the way down into the lower back.